Hey guys, welcome to another Really Strong video. Today we're going to be discussing something that a lot of pregnant women complain of, and that is round ligament pain. Just a reminder to subscribe to the channel if you haven't already, and check out our advice playlist if you have any questions on other common conditions that pregnant women tend to suffer from. But what is round ligament pain? So it's typically described as a sharp, intense shooting or burning pain in the lower belly, abdomen or groin area, and women tend to feel it on quick or sudden movements, when turning, getting out of bed, maybe when reaching for something. These are the movements that tend to bring on that really intense sharp pain. But where does the pain actually come from? So it's in the name. It comes from the round ligaments, and these are ligaments that connect the outer sides of the uterus down to the pubic bone. So they move in a kind of diagonal fashion down along the belly, and pain is thought to come from the stretching of these ligaments as the belly grows, as well as irritation of some of the nerve fibers around the round ligaments, which give it that characteristic sharp pain. It can be one-sided, or you can feel it on both sides, and most women tend to start feeling it around the second trimester, although it can be earlier. It's not dangerous, but it can be really uncomfortable, and there are things we can do to help. Something that can assist is getting ligaments stretched and used to movement beforehand, before the belly starts to get really big. And we do these with certain movements that we'll go through later on in the video. But this means that when it comes to sudden, quick movements, because those ligaments are now used to movement, they're not surprised anymore. Keeping up your core strength and maintaining good posture can help take the load off of the ligaments, because the stronger the core muscles are, the more stability you have in the region, the more stress the muscles take up, and then that stress no longer goes into the ligaments, which can help with pain. Have a look at our video on how to activate the deep abdominal muscles for some tips on abdominal bracing. And if you are following the pregnancy workouts, there are plenty of core exercises in there to keep you strong through pregnancy. Gentle massage can also have some relief, and you do this by placing your hands on a diagonal on your belly, with one hand near the belly button, the other near the outer hip or pelvis. You apply moderate pressure downwards and pull the hands apart as you stretch the tissues. And you can do this with oil or without oil. After a hot shower, it can be quite nice because the tissues are warm and relaxed. And we're just applying tension to all of the tissues in the belly area around that round ligament to apply a bit of stretch and tension and get it used to being moved and manipulated. Other movements that you can integrate into your routine or daily life are diaphragmatic breathing, and we do have a whole other video on that, but just to recap some of the main points is you want to place your hands on your belly just to make sure you're getting the correct expansion. You'll inhale through the nose, and as you inhale, you'll push the belly outwards, almost like you're trying to get the belly itself to fill with air, and you'll feel a stretch on those belly muscles. And then you'll exhale through the nose. And this is something that you can do while you're sitting at your desk, watching TV, just letting that diaphragmatic breath stretch the belly tissues, and then relaxing. Our next one is a cat-cow, and this is done in an all-fours position. So you'll want to arch your back up to the ceiling, really rounding the spine, tucking the chin in, and then coming down in the reverse direction. So arching that back, sticking out that buttocks, and looking forward, although you don't have to look too far forward because you don't want too much pressure on the neck. And this cat-cow mobilization will stretch some of the tissues again around those round ligaments and around the belly area to start to expose it to movement and stretch. From cat-cow, you can move into barrel rolls, and these are circular pelvic movements. So you're circling the pelvis in one direction, letting the whole torso follow. And as that back arches, you should feel a stretch on some of those belly tissues. And you do this in one direction. You can do it 8 to 10 times one way and then switch directions to do it in the other direction. The body loves movement, and if you can continue moving and strengthening in the correct way with the proper form through pregnancy, it can do a lot to help prevent or minimize symptoms from conditions like round ligament pain, pelvic pain, back pain, carpal tunnel, everything. That is our video on round ligament pain. Share this with any friends who may have similar questions. Subscribe to the channel to join our local community, and I will see you again on another video soon.